Hey folks, it's Dr. Mike, and I would like to take a few moments just to thank you for all of your birthday well wishes. Yes, I had a birthday earlier this month. I turned a big 57, and thank you so much for your cards, your emails, your Facebook messages, your text messages. I had a fantastic birthday, and I've turned a big 57. Well, let me say this. The last 24 of those 57 years I've spent with you, medical exercise specialists around the world. Now we're on 6 continents, helping you bridge the gap between healthcare and fitness. And actually, I shouldn't say I'm helping you. You guys are doing it, and you're doing it in a big way. Some of you are getting insurance reimbursement for your services. Some of you have established referral relationships with doctors, therapists, and chiropractors. Some of you even have your practices in medical facilities now. So you're doing great things, which means this whole concept of medical exercise training is continuing to grow. When we started the Medical Exercise Specialist back in 1994, we did our first course at the Quality Inn Hotel on Colesville Road in Silver Spring, Maryland, right outside of DC. We had 13 participants. We still hear from those 13 individuals, and they're all still practicing as medical exercise specialists. And as I said, you guys have done great things since then. We're going to see an expansion and an exponential expansion in the need for medical exercise training over the next 2 decades because of the aging of the baby boomers. Our healthcare system can't absorb all of them, and we're going to need exercise to become a key in the management process for chronic medical diseases. And as a result, what we're now seeing is this bridging of the gap. You can see here we have a medical professional. He has a chart in one hand and a dumbbell in the other. Now, the medical professional knows all about the medical procedures and guidelines in managing medical conditions. But you, the medical exercise professional, you have the expertise in exercise, and we know this need is going to grow because insurance carriers are cutting back, but also our population is getting older. We have more chronic diseases. So we're going to need now individuals to lead this idea of bridging the gap between healthcare and fitness. We need individuals that now can step into administrative roles, management roles, can also teach, as well as being liaisons between the medical community and the fitness facilities. So guess what? Back in 1999, we started a certification, the Medical Exercise Program Director. And we started that 5 years after our MES because we realized we needed someone now to serve as the director, the liaison, the administrator, the marketer, the promoter, to promote all of these programs, manage all of these medical exercise training programs, and most importantly, to be the liaison between the medical exercise training facility and the medical community. So take a look. That's exactly what the Medical Exercise Program Director does. They administer, they market, they manage, they promote, they teach in the medical exercise training program, and they serve as the liaisons between the medical exercise training program and the medical community. That role right there, folks, is going to get bigger and bigger over the next 2 decades. As a result, we now are looking for leaders. We're looking for individuals to step into that role as Medical Exercise Program Director. We're looking for individuals who've gone through the MES or the PRCS, individuals that maybe have some experience working in rehab settings as physical therapy technicians or exercise technicians. We're looking for individuals now that are ready to lead. So here's my question. Are you ready to lead? Not just simply you're the person who has the most clients or you have the best looking physique, but you actually understand how to integrate exercise into the medical management of these chronic conditions, and you're willing to be the liaison. You're willing to be the catalyst to talk to doctors, therapists, and chiropractors and tell them what medical exercise training can do. And most importantly, you're willing to be a consultant when the doctor doesn't know what to do with a client with regard to exercise, or the therapist may not know exactly what to do. You now can step in and be that individual that gives them the information, that individual that understands the latest research, that individual that can share that same information with your staff members, and that individual that can go out and promote and market a medical exercise training program. Now, we need more of those because over the next 2 decades, medical exercise training is going to grow exponentially. So as a result, we've now taken a little bit different twist with our Medical Exercise Program Director certification. We're now doing it as the MEPD Mastermind, or Medical Exercise Program Director Mastermind, and we're using the theme MET Systems, the Keys to Success. We're going to start this January 7th of 2019. Now, 2019 is important because 2019 will be our 25th year offering the medical exercise specialist. So it'll be our silver anniversary year. And we're going to offer a number of new programs with new twists along the way. And some of these will be old certifications, but what we want to do is give you more opportunities to bridge that gap between healthcare and fitness because, folks, I'll tell you, medical exercise training is growing far more rapidly than I ever anticipated. So now, if you want to be involved and become a medical exercise program director, take your skill set, your career to the next level, then join us for our MEPD Mastermind. Go over to MEPDmastermind.com, and this Mastermind program to lead to the medical exercise specialist certification is geared toward you bridging that gap between healthcare and fitness. I don't think there's been a more appropriate image that I've found over the last 24 years that really depicts what we need our medical exercise program directors to do. You've got to step into this role, not as a medical exercise professional, but as a medical exercise program director, and say, hey, I'll be the one that understands all the information on managing that condition, but I'm also the expert in exercise. We need program directors. With that, our next MEPD Mastermind starts January 7th of 2019. Again, our 25th anniversary year. And again, our theme is MET Systems, the Keys to Success. Please, if you're looking to lead, be a leader in the medical exercise training movement. You're looking to bridge that gap between healthcare and fitness. You want to maybe take your practice to a higher level. You want to help your facility grow to a higher level. You want to help other medical exercise professionals. Then please go over to MEPDmastermind.com. Get registered. Our MEPD Mastermind starts January 7th of 2019. We only have 8 slots available. So please go over there, get more information. On our website, we'll give you a lot more detailed information on the program. But folks, let me tell you this, the need for medical exercise program directors and medical exercise training is growing and will continue to grow over the next 2 decades. We need someone now that can be that liaison, to tell the medical community how medical exercise will help. But also that someone that understands medical exercise training is not designed to take the place of physical therapy or chiropractic care. It's to augment those services. And the bottom line is, can we help improve the level of function for individuals that have chronic medical conditions? And exercise is the key to that. So thank you for, again, your well wishes. Thank you for the great things you've done as medical exercise specialists and post-rehab conditioning specialists out there. And hopefully we'll see you in 2019, our 25th anniversary year, in our MEPD Mastermind. So thanks again, all the best, and all the best to you over the holiday season. Thank you very much.